Hello, my name is Dana McCormac and I'll be demonstrating a subcutaneous injection. So it is February 7th, 2021 and it is 0825. I'm going to compare the physician order with my MAR. I have nursing, Jake, 312, 654, 987. January 1st, 1960, January 1st, 1960, known allergies. We're looking at metoclopramide, 5 milligrams, subcutaneous, daily, so February 7th at 0800, that has not been given yet, and this is double signed. So I'm going to wash my hands and select my medication. So I have metoclopramide. We want 5 milligrams. This comes in 10 milligrams per 2 milliliters, so 5 milligrams in 1 milliliter. Subcutaneous. This vial does not say subcutaneous, so I would call the pharmacy as well as check the drug monograph. And the drug monograph as well as the pharmacy has confirmed that this is okay to give subcutaneously. And so I'll continue with this injection, and it's to be given daily, February 7th at 0800, that has not been given yet. And this vial is not expired. So I will check my drug monograph, metoclopramide. This is what we're giving. Metoclopramide is an antiemetic. Student nurses can give this injection. The maximum single dose is 20 milligrams. We are giving less than that with 5 milligrams. And it does say here that it can be given subcutaneously, which we confirmed with pharmacy, so that is okay. I'm going to set that aside and wash my hands and get a new alcohol swab and swab the top for 30 seconds. Okay, that's been 30 seconds. I'm going to get my blunt fill needle, my 3 milliliter syringe, and my 25 gauge and 5/8 inch injection needle. So I will get my sterile unopened syringe and my sterile unopened blunt fill. And we calculated that I'll need 1 milliliter to get the 5 milligrams of medication. So I will inject 1 milliliter of air into my vial and get 1 milliliter of medication out. So I am going to recap. Make sure all the medication is out of the needle and get out any bubbles. Okay, so again, the medication is out of the blunt fill, so I will just put that in the sharps container and get my injection needle, which is also unopened. And I will fill to the 1 milliliter line to the point where there is a bleb at the top. I would not leave my medication unattended, but I will show you my needle, and I will make my label. So this is for nursing Jake. It is metoclopramide. 5 milligrams is the dose and the volume is 1 milliliter. The concentration was 10 milligrams per 2 milliliters, and it is February 7th, 2021 at 0825. That's my signature. Again, I wouldn't leave my medication, but I'll show you my label that I would attach to my needle. Good, so now that I have my medication and my label, I will do my second check. So I have nursing Jake, metoclopramide, 5 milligrams. This comes in 10 milligrams per 2 milliliters, so I have 1 milliliter to get the 5 milligrams, and I have 1 milliliter here. It is subcutaneous. We check the drug monograph as well as called pharmacy, and this can be given subcutaneously. and it is to be given daily, so February 7th out of 800 that has not been given yet, so we can give that. And again, this wasn't expired, so I'm going to set that aside and I'll get my supplies to go to the room. So I have a pen for documenting my drug and my label, my MAR, an alcohol swab, gloves, and a cotton ball as well as my drug card. So I'm going to enter the room, I'll do my entrance safety check, and I will introduce myself. Hello, my name is McCormac and I'll be your student nurse for today. Is it okay if I check your wristband? And can you tell me your full name and birthday? Good, so nursing, Jake, 312-312-654-654-987-987, January 1st, 1960, January 1st, 1960, and do you have any allergies? No? Okay, good. So, I'm going to wash my hands, and I'm going to check, I'm going to do my third check, is that okay with you? Okay, so I have Nursing Jake, and we verified this is Nursing Jake. Who has no known allergies, which is what he stated. Metoclopramide, 5 milligrams. The concentration was 10 milligrams per 2 milliliters, so I do have 1 milliliter here. Subcutaneous, this medication is subcutaneous. It can be given subcutaneously. We checked the drug monograph as well as called pharmacy, and this is a subcutaneous injection needle, and it's to be given daily, so February 7th out of 800. That has not been given yet, so we can give that. So I'm going to wash my hands again after I've done my third check. So Jake, this medication is an injection, and it is called metoclopramide. It's for your nausea and vomiting that you've been experiencing from your chemotherapy. So I have taken your vital signs prior, and you are in the safe range to give. Also, I do know that you have vomited recently, and so this medication will be good for you. Some side effects that you can experience after with this is headache, dizziness, and drowsiness. Just to let you know, is it okay if I give you this medication? Yeah? Okay, good. So now that I've had permission, I've done my third check, I've given my patient education of what it's for, I'm going to locate the injection site. So this is subcutaneous. I'm going to give it in the abdomen, 5 centimeters away from the belly button, and I'll do the upper left-hand quadrant. So now that I've located my site, I'm going to wash my hands and put on clean gloves. And I will swab the site for 30 seconds in a circular motion with an alcohol swab. And while that dries, I will get my injection needle. So because this is subcutaneous, on this patient, I'm going to pinch an inch and insert at 45 degrees. I will stabilize and inject. I'll wait a couple seconds, remove the needle. I will activate the safety using the table, set that aside, and put in the sharps container, dispose of the needle in the sharps container, and put a cotton ball on the site. I will remove my gloves and wash my hands, and I will document. So it is now 8:08:25, and I am DMUMSN2. So Jake, as I said before, you can experience dizziness, headache, and drowsiness from this medication. So if you need anything, please use your call bell, which I have here. You're in the lowest position. Do you have any questions at this time? No? Okay, so I will be back in about an hour to check your vital signs, especially your blood pressure, because this medication can affect that. And you are in the lowest position, you have your call bell. So I will exit the room and do my safety check and wash my hands.